Did you know the first few chest compressions do not actually create blood flow? Initial compressions have to build up sufficient arterial pressure before blood can circulate from the heart. Every time compressions are stopped for 10 seconds or more, this arterial pressure is lost and you have to start back from square one. Quality chest compressions are what lead to increased patient survivability outcomes. These chest compressions provide an uninterrupted blood supply to the brain and the heart itself. If chest compressions are stopped for more than a few seconds, this blood flow to the rest of the body will also stop. This is why it's imperative to minimize interruptions in chest compressions to maintain a continuous blood supply. Think of the analogy, the heart as a fire pump. High-quality chest compressions are needed to prime the heart prior to blood circulating. If chest compressions are stopped, prime is lost. Let's take a look at the forestry pump as the example of our heart. The suction hose represents the veins, the pump itself the heart, and the hand pump in this case will represent our work doing chest compressions. The initial compressions to prime the pump and build up that pressure, and the ones after that to actually create the blood flow, 30 to 40% of what the heart normally would. Now, let's watch the following demonstration as a side-by-side comparison of chest compressions and operating this hand pump. Did you know the Zoll defib that EHS now uses has the ability to provide us with valuable CPR feedback as well? It's called the X series. Now let's take a high-level look at the info that it can provide to us. Correct placement of the pads and hand positioning on the accelerometer, or puck, are paramount in order to get a good reading when doing CPR. If partway through a resuscitation, the Zoll defib starts saying, "push harder," but the person doing compressions knows they're still doing good CPR, check your hand positioning and the position of the puck itself. It tends to slide around if the patient is diaphoretic. Also, please note, HRFE pads are not compatible with the Zoll monitor. Now let's take a look at the information on the display of the Zoll monitor itself. It may look confusing, but it's actually quite organized and can be very useful for first responders. On the CPR screen, numeric readings of depth and rate are displayed. These numbers will change from green to yellow when outside of AHA guidelines of 2 to 2.4 inches and 100 to 120 compressions per minute. The release indicator bar shows when a person is coming fully up with each compression. If the bar is not full, it indicates you are not allowing for full chest recoil. The perfusion performance indicator, or diamond, is a visual representation of the negative impact of pauses during compressions. When compressions are stopped, the diamond rapidly empties, signifying rapidly decreasing coronary perfusion pressure, or loss of prime of the pump in our world. Continued high-quality CPR will keep the diamond full. The monitor displays a CPR countdown timer from 2 minutes, which is extremely helpful for the person doing compressions to know when they're getting close to another analyze. Ideally, after every 2-minute round of CPR, the person doing chest compressions will switch with someone who is well rested. That way the quality of compressions never changes. However, if compressions are stopped for longer than 10 seconds, the timer will rapidly show a CPR idle time. This is a bad sign and should not be seen during a resuscitation unless you are performing an emergency move or otherwise. Similar to the HRFE Samaritan AED, the Zoll unit emits a metronome to guide rescuers. Staying in pace with that metronome will ensure compressions are performed at the correct rate. If chest compressions are consistently less than the desired depth, the unit will state,
"push harder."
When consistent, it will say,
"good compressions."
The Zoll monitor is meant to assist both EHS and fire on cardiac arrests. Though only EHS paramedics are permitted to utilize the monitor's functions, the monitor screen needs to be positioned so that the person doing compressions can see it. That way they can deliver consistent, high-quality compressions for the full 2-minute round. For many years, it has been thought that saves in cardiac arrest were a result of the ability of paramedics or ER staff successfully placing an advanced airway and ventilating the patient. However, more and more research is showing that high-quality chest compressions are directly linked to higher survivability outcomes. That means, of all the roles being carried out during a cardiac arrest, the people doing the chest compressions are actually the ones that increase the person's chance of return of spontaneous circulation, or ROSC. This is all through a well-coordinated team approach. Key points to remember. Maintain chest compression fraction greater than 80% of the time. That means in 10 minutes of doing CPR, at a minimum we need to be compressing the chest for 8 of those minutes. Stay on the chest and limit interruptions. Maintain a rate of 100 to 120 compressions per minute. As well, always have a depth of 2 to 2.4 inches with each compression. Finally, avoid leaning on the chest, which prevents full recoil and does not allow the heart to fully fill with blood between each compression. Thank you for your attention. Now it's time to get up and put these skills into practice.